I think one of the most challenging parts of this was that we had to have every country participate. If you're going to eradicate a disease from the world, it meant that everybody had to participate, and probably 50 countries would have to do certain activities that would be very special and were above and beyond what they normally would do. Trying to assemble that many countries with the will to do that was the first task. And this is the first time I think anything like this has been achieved. The second problem was that of the strategy that we were to apply, and here we came down to a few simple things. One was a vaccine which we were very sure would work, was potent, and was stable so you could use it in the field. And the second was to decide how we would use that vaccine. And we decided that mass vaccination was part of the story to get a level of vaccine protection across the country. But the second part was what we called surveillance and containment. Try to get reports promptly about cases, and then have teams go out and try to block off the continuing spread of the virus. So it was find the cases and stop the spread. And that second part of the strategy was new and turned out to be remarkably effective. When the program began, we didn't have the internet, we didn't have Facebook, we didn't have Twitter, we didn't have telephones in most places. We had telex in some places, but it was too expensive to use. So mostly this required travel and communication and trying to obtain very good people who would be in a position to make judgments and to sit down with the countries and work out some difficult situations wherever they may be, and for us to learn from that and to transmit this to others that were in the program. And so a lot of steps in the program changed as we learned more, so that we evolved the program bit by bit over the 10 years. And at the same time, there was research going on in laboratories to get a better way to vaccinate than the one we had. We worked to get a better vaccine, various techniques that were used, and there were other aspects that made it possible to make the program more effective, and we learned them as we went along. Well, I think the most important lesson we learned was that a well-planned program with a comparatively few people could accomplish a great deal, particularly if you involve the community. And you have a community support, you can do a lot in terms of vaccinating a great many people rapidly, of finding cases, of providing information. So that I think this was one of the lessons that was most important. A second lesson we learned was that very young people could be entrusted with a great deal of responsibility. Someone had said at one time what we needed were young people who didn't know that they decided it was impossible to eradicate smallpox. And so they went in and tackled it, and with an enthusiasm which is unbelievable. People working 31 days a month and resenting if they have to take a couple of days off for special meetings or planning, living under conditions which were totally unfamiliar to them, eating local food and living in very hot climates. I was surprised at how many people really just threw themselves into it. And they were the real heroes in this. One of the things that was important was that here was a program that could really only be done under an international organization like WHO. To bring the people together from different countries. We had 70 different nationalities working in the program at different times. To be able to deal with heads of state, ministers of health from the different countries, and to bring together one common plan, and that people could pursue this. This could not be done by any one country or any group of small group of countries. This really required a WHO, and I think it showed to our colleagues in the organization that there's a lot of potential within the organization, and that we can do more now than we ever could before.